I'll run through the roll real fast, and then we can turn it over to you and get started.
Great, thanks.
Here at the department today, we have Ron Davis and Natalie Kelly joining us. Amy Perry, can you hear us?
Yes, I can.
All right, good morning.
Good morning.
Powers, can you hear us?
Yes, I can. Good morning.
Good morning.
Morning.
Gloria Smith, can you hear us?
Yes, I'm here.
All right, good morning.
Morning.
Linda Levin, how are you doing this morning?
Good, I'm here. Can you hear me?
Yeah, I can hear you. Thank you.
Okay, great.
Mary Barnes, good morning.
Good morning.
How are you?
I am fine.
Great. Scott Solkoff, can you hear us?
Yes, good morning.
Morning. And Stacy Payne, can you hear us?
I can.
All right, good morning. Yeah. And we also have Ted Wolfendale and Todd Goldie. We don't have a connection with you, but we're working on that as well. So with that, Mr. Chair, we do have a quorum.
Great. Thank you, Josh, and thank you, Chandra, for diligently working through this. Good morning, everyone. Sorry we're starting a little bit late. Not sure if I was the cause of that or not, but my connection wasn't working at all, so just made it a little bit challenging. So at any rate, we'll convene this meeting of the Purple Ribbon Task Force. I want to just give a brief kudos to the staff at the department for working hard to put together all the materials in a timely manner and to give us some our first looks at some draft reports. Hopefully you had the opportunity to review the material that was presented to you. I know many of you have worked excessively hard on putting that work together through the subcommittee process. Had the opportunity to read through the materials, and obviously the draft executive summary, we have a ways to go yet, but I want to thank specifically the task force members that worked on the draft research report. I think it is well done and very illustrative of what's going on in the state of Florida and some of the needs that are out there. I also want to thank the group that worked on provider data and maps. They are, if they don't paint a clear picture of where we have gaps in our state in terms of providing care to individuals with this disease, I don't know what does. They are very illustrative of the issues out there that the state faces. So I guess at this point, I think we should begin by having a discussion on the draft executive summary. What I would hope is that, Josh, you're going to take some feverish notes from the feedback that we get from the members regarding the draft and the executive summary and the thoughts that people have and what might need to be included and what yet needs to be included and so forth. And so with that, I would ask that the members, if you could put the draft executive summary up on the screen, if the members have questions regarding that particular summary or want to make some comments, you are recognized to do so. If you would raise your hand, I will unmute your mic and give you the floor. Not all at one time. Mary Barnes, you're recognized.
Hey there. I think it's a great beginning for an executive summary. I think that we at Florida, this is something I would be looking at, that a lot of information would be coming from another state. Our state has been very involved with Alzheimer's since 1985. And there's been, as an executive summary, in capturing what has led us to today. And I would have put in some historical information on the Alzheimer's Disease Initiative. I would have identified that within where we've been in developing the legislation for the Florida Silver Alert, which I don't see anywhere in any document, of how we have gotten law enforcement to a wonderful place in being able to save lives, which they're doing every day. And we did have some experiments like the Alzheimer's disease, the Alzheimer's Medicaid waiver, which we learned many lessons from. And there's other work that has been done on such things as the elder law, like in Hillsborough. The Elder Justice Center also was over here in Palm Beach County. And there is, as far as research goes, the state has put much money into such, because we're heavy down here in Palm Beach County with Scripps, Max Blanc, we've got Torrey Pines. There's a lot going on, and that's not mentioned in this document at all.
No, I believe if you look at the draft that came from the research group, you'll see much devoted to the research side of things, breaking it down, even talking about NIH grants and opportunities there. I think that your comments regarding filling in some of the blanks from a historical perspective make good sense. You never know where we're going unless you know from where we've come from, and I think that that is a very legitimate thing that should be added in there. I think that our component of our draft report or our report will have a section devoted to the research side of it, and so I think that will be covered with that. But you're correct in the summary that we should probably identify some of the historical data from where we've come. Very good point. Let me recognize Stacy Payne next, who has a question or a comment. Ms. Payne, you're recognized.
Yes, thank you. I just have one request. Unfortunately, I was unable to open any of the Word documents, so I really can't see but the little bit that's up on the screen at the moment, and could not have reviewed it earlier. Perhaps we can resend those as a PDF document so that I can reopen them.
No problem. I'm sure we can get staff to send that out to you. And as I'm sure they're sitting there listening to this, they're probably working on doing that right now. And if Josh, there's a way that you or Chandra can convert those and send those to Ms. Payne and maybe to the entire group that might have also had problems opening it, that would be great if you could do that.
Absolutely. We're PDFing it right now and sending it out, and then also we can take comments via email directed to staff, and after the webinar and as we work to put the draft together. So we're sending that out again, and can continue to take comments. We do have Mr. Davis here who has a couple comments on the executive summary.
Okay.
Good morning.
Go ahead, Mr. Davis.
Okay, good morning. I spoke with Josh a little bit before the meeting started, and I did indicate to Josh that I would be sending my comments to him by email shortly after the meeting. And I've got about 4, but I will only speak to 2 at this time. The first is that in the second paragraph where it talks about the estimated cost or lost costs for caregivers, I would suggest that that figure may be low. It may be low for 2 reasons. First of all, if you presume that a number of caregivers are no longer able to work full-time, and you do a little bit of math, then if you look at that at, let's say, 35,000, then that gives you a figure of 20.65 million. If it's 60,000, then that figure jumps up to 35.4 million. In addition to that, the caregivers also have to provide out-of-pocket costs for materials to help people that they are caring for, such as pads and wipes and things of that nature, which are very expensive over time. The second comment that I have is that back on the second page, where there is an outline of what the task force was designed to do, much of it rightly focuses on the nature of dementia and the impact of dementia to the state's population and anticipated population. I would like to see more emphasis placed on the impact on caregivers and more specifically on resources that might be identified to assist caregivers as we move forward. Things such as additional information, resources for mental and physical support. And for those caregivers who wish to work part-time, then any assistance that might be available for that, because certainly full-time work is not an option. And with that, thank you very much.
Mr. Davis?
Yes.
I have to apologize. For some reason, my phone call dropped, and I got disconnected. So I just called back. I apologize. I missed some of your discussion. I won't have you repeat it because I'm sure that staff obviously heard it and so forth. I did have one question with regards to your comments, and when you were talking about calculating the expense of for caregivers in paragraph 2, you mentioned, well, I guess the question is, Josh, where did we come up with that number of the $14 million? Was that calculated at, the median income of Florida, the average income of Florida, a census number? What was the computation that created that $14 million number?
Stephanie got it, and I think she.
One second.
I think Stephanie got it from here.
It's in one of the reports that we pulled. We'll go back and look at which report that was specifically, and what we can do is we can note the number that was in the report, but say, however, it's a difficult estimate to arrive at. And if you look at some of these other factors with this many caregivers, some of the things that Mr. Davis mentioned, the cost could be much more than the $14 million in the report, and based on these estimates could also be, whatever they are, 20 million, 30 million. We can, note the different ways to arrive at those estimates, and that, the problem, could be a little underreported in what was published.
Well, I would suggest that, we'll never give an exact number because obviously, the income of one caregiver is going to be different than the income of another caregiver, and so using the state average is probably not wholly appropriate. However, I would suggest that we use a range and say, at a minimum 14 million could be as high as, say, 25 million, and then show a breakout as to how we come up with that. Because realistically, you're going to have some people that are at the lower end of the scale, some people at the higher end of the scale, and that number is always going to be changing as the population changes.
Absolutely. We're taking notes on that, and we'll work on that section.
All right. Let me recognize Mr. Solkoff, who has his hand up. You're recognized, Mr. Solkoff.
Thank you. Yeah, I think it's an excellent start for an executive summary, and I think that, if our ultimate goal is to lay out a framework and reasons why we're going to reach certain conclusions. This does that, with one exception that I would like to see discussed, and that would be, I think that most people who are not in the field believe that there is insurance that covers more of the costs than we know that exists. So that people that have certain illnesses, like if you get cancers or blood diseases or heart disease or other illnesses like that that are more discrete, your Medicare or other private insurances would cover that. But when you have dementia, Alzheimer's disease, Parkinson's disease, most of those costs are not covered by insurance, as we know, but most people don't know that. And so we have a disparate system in terms of payment for long-term care, and I feel that if there's some discussion of that, some point of that, that it will then help give context to what I think is going to be coming from our report.
I think that's a very good point, and certainly as much as we are hoping to create recommendations and to create a strategic plan, part of our responsibility, I also believe, is to create awareness, and I think that's a very important component of that. Good comment. Next, I'm going to recognize Todd Goldie. He has his hand up, although I'm not sure he's able to communicate. He doesn't seem to have, Josh? Has he found?
We're trying to work those issues out. We did send him a message that asked him to tell us the question via the chat, and we can relay it to the task force. So we're working on getting it, and if he submits a question, I'll raise it for the task force or comments.
Okay, very good. Dr. Goldie, you do have your hand up, so if you would put that question into your chat, that would be excellent. That way we could all get your input. I'm going to go back now to Mary Barnes, who has her hand up. Mary, you're recognized.
Thank you. I want to piggyback what Mr. Davis brought out about the report. Don't get me, please know that I'm not criticizing. I've just been doing this since 1985. I have a long history of knowing what's happened in Florida. So one of the things I would love to see captured in this whole identity of Alzheimer's is that it is a family disease. And the other thing is that unlike other diseases where you have a hole or you have a festered sore or you have a broken arm, you cannot see Alzheimer's, and all the behaviors that cause such emotional, terrible types of outcomes in our community in Florida is generated by behaviors. It's just, and that's the nature of this disease, and of course it affects the family. The other thing is that in this, I would love to see that there have the whole story when you do an executive summary, is the Compassionate Act that was passed by the federal government. You know, we have a lot of Social Security people, and having this Compassionate Act really is a help. And I also want to identify the cultural issues. We have a couple of Hispanic, we have a lot of Hispanics with our programs and our services, rather, and every one of those caregivers work, every one of them. And they're struggling with keeping mom and dad at home, and so the impact that this very minimal wage earner is bringing to our stabilization and really trying to do their part is huge. So the cultural issues are huge for Florida, and that's not even mentioned in the executive summary, too. Again, it's a good beginning, but there's definitely a lot we could say, but we need to make this a Florida document, in my humble opinion. Thank you.
I would say that, first of all, you are correct. It obviously has to be a Florida document. I would also tell you that I believe that you are correct in wanting to make the various points regarding different demographics in our state and how different communities of populations in our state handle this differently. and the challenges associated with that. I think those are all very valid points. Now, that being said, while we're having this task force meeting and we're talking about it, it is extraordinarily important that each one of the task force members write their comments regarding the executive summary in detail and send them to staff. Because while staff is copiously writing notes and listening, we don't want anything to be missed. And so to Mr. Solkoff, to Ms. Barnes, and to Mr. Davis, your comments are spot on. They're good comments. And I know Mr. Davis mentioned that he would be forwarding his comments in writing as well. But that's really, really important, and I can't stress that enough. You've got to make sure that you put down your thoughts in writing because, quite frankly, there's bound to be things that, hey, we get off this call and you go, oh, crud, I wish I had mentioned whatever. So make sure that you bring all your comments up in writing so that we have them all. Because at the end of the day, that's why everyone is on this panel with some diverse backgrounds so that we get the entire range of things. And we do make sure that it's a useful document so that my colleagues in the legislature and that our state agencies have some tools in their toolboxes to move forward. Does anyone else have any questions regarding the executive summary itself? Anybody else wants to raise it?
This is Josh. We have Dr. Goldie's comment I can share with the group.
Yes, that would be great.
Okay, Dr. Goldie mentioned that we need to align the numbers throughout the executive summary and throughout the entire interim report. And there's some inconsistencies and zeros missing in some of the figures. So that's something that, as we go through the process of compiling the interim report and adopting or including all the comments from the task force members, we'll make sure that we go over that thoroughly to make sure that we're not leaving off zeros or that sort of any of that information. So we appreciate that, and we'll make sure we keep everything consistent.
Okay.
This is Natalie, Mr. Chair.
Okay. Go ahead.
Mr. Chair, my comment is I think this is an excellent start, and I really do. With just a few meetings that we've had, I think this is, you did a great job. And I think what we can do, instead of just nitpicking it right now, definitely send back comments. But my question is, well, we can have a deadline, and probably the sooner the better, because what happens, we get into the holidays and we don't get things back. And I'd love to have a deadline so that I know we can jump on this and get all the information that you need.
Well, Natalie, I love a good deadline. And so, Josh, if you will put up on the screen the agenda for a moment, you will see that there is a timeline down on the bottom. Now, my suggestion is that inasmuch as we've asked for all of the data from the task force to be submitted by the 28th, any of your additional comments, questions, concerns, things you love, things you hate about the executive summary as it stands now, I would ask that they be submitted no later than the 28th, preferably before then. Obviously, we'll certainly have some period of times when our state offices will be closed. And so we do not want to have this all pile up at one time and have Josh coming back to an email inbox that is full. So if any way you can get your comments in earlier than that, that's fine. But we're going to use December 28th as the deadline for draft comments to be submitted by the task force members. Now, again, once we go into draft 2, we'll then have another period of time for some additional comments. But I would like these comments to be in no later than the 28th. Thank you, Natalie, for bringing that up. I did see a moment ago that Amy Perry had her hand up. I'm not sure if she still has a question or not, but let me go to her real quick and see if she does. Ms. Perry, you're recognized. Did you have a question, girl?
I was going to ask the same question, so thank you. Got my answer. No one we can get it until we need to get our comments back.
Okay, I did not hear that.
This is Josh. We're having a little difficulty hearing. Okay, Amy Perry just sent us a message saying she had the same question about timelines. So I think.
Good. Well, then we have a case of great minds thinking alike. That's lovely. Okay. Next up on the agenda, so there are no other questions or hands raised, let's go to the discussion of the draft research report. And by the way, just as a general rule of thumb, I know the staff has been good about sending out the documents in advance. If there's a situation where you receive an email where you can't open it, or there's an attachment missing or something like that, please notify staff as soon as possible so that we can get you a complete email or a formatted email so that you're in a position of being able to participate fully in the group. We want full participation, and I know we have busy challenges and busy lives, but I certainly want to make sure everybody has that opportunity. Just to begin with, and I mentioned in my opening comments, the research work group, I have to tell you, I think did a very, very strong job on putting together this draft report. There is a tremendous amount of information in here that really talks a great deal about what is going on regarding research in the state of Florida. And I should mention to the group, each of the institutions that they're working on research, you know, a tremendous amount of their information is proprietary, and so it is not something that can be generally shared with everyone, because obviously there are some competitive advantages and so forth amongst the institutions. So I think this document does a very good job of giving a fair amount of detail and a good overview as to what's going on in Florida regarding research. And so if there is anyone on the call that would like to make some comments regarding the research work group draft, I would certainly take that now. So if you have comments on the research paper or the research work group paper, please raise your hand so that I can get those and we can get your questions. Anyone?
Representative Hudson, this is Josh. I had just one comment.
Okay.
Just wanted to, on the research portion and also some of the disaster preparedness information that we received, there are some, the discussion leads to some recommendations, and we left that in to distribute to the group, but it was our intention for the interim report just to be a sort of a status of where we're at as a state, but we left that in for this discussion just because I think it illustrates how, as we put together the interim report and look at where we're at as a state, that sort of shows how it naturally leads to where there are gaps and ultimately where recommendations can come from. So in these documents and in these discussions, you know, we left the recommendations in just to show how this will progress into stage 2, but for the interim report, we're just going to keep it as a status of where we're at in inventory and what the gaps are in the state.
Okay, I think that's very good for the group to know. I think it's important that when we put together our recommendations, we put them all together at one time so that people can see the enormity of the project ahead of us and not get distracted and not undermine one particular area or another. I do have a couple of people raising their hands, and so let me take them. Gloria Smith has her hand up, and you are recognized.
Yes, thank you, Mr. Chairman. I want to make sure that we don't forget a key piece in the research piece where we're talking about the NIH funding, and yes, it is inadequate, but there is also a national plan that the President signed this year that is really targeting increased funding for NIH. So I think Florida and Florida's leadership can play a significant role in supporting the national plan, which will obviously support Florida as well as all the other states.
Yeah, I think that is a valid point. I would be, as all of you certainly watch the news like I do, obviously there's a lot of talks going on about fiscal cliff and so forth, and as I was given a presentation about a week and a half ago in Tallahassee regarding the state economic picture. There are a tremendous amount of unknowns regarding various programs that already affect Florida and that could potentially affect Florida in terms of unknowns from the fiscal cliff discussions. And I don't think there's anybody in this country, with the exception of maybe the President and the Speaker of the House, that have any kind of a crystal ball as to, or an accurate crystal ball as to where we're actually going. So since our report is due in January, I think that we can certainly update the plan as the discussions of the fiscal cliff come to fruition. And if there are things in there that are positive, I think they can be added. If there are things that come out of that that are negative, they can certainly be added as well. I think it is certainly a valid point to discuss the bigger global picture of where some of our funding comes from and the intricacies of that. I think that is a valid point. Let me go back to Ms. Smith for another question. Gloria?
I'm sorry, I didn't hear the last part.
I just said I was throwing it back to you. You had your hand up again.
I think it's still up from the last time.
Oh, okay. Well, then put your hand down. I'll grab somebody else here. Very good.
Thank you.
Yep. Mary Barnes, you have your hand up. You're recognized.
Oh, I'm sorry, sir. Thank you, Mr. Chair, and I think you're doing a great job. This is a difficult thing when you're doing this kind of meeting. In the research infrastructure and support for AD research, could I get a clarification on the definition of physicians in this case? When you describe in the bullets, Florida scientists and physicians have played major roles in defining the genetic underpinning, and then you bring physicians up again and many, many times. What kind of physician are we talking about here?
Well, that's a very good question, actually. And I'm not sure if we have someone from the task force subcommittee that might be able to address that, or maybe Josh might know. I do see, by the way, Josh, excuse me, Ms. Barnes, but I do see that Dr. Goldie has his hand up again. So Dr. Goldie, if you would write in your question or comment to Josh in the chat box, I'd appreciate that. And additionally, if you could answer the question in chat regarding the physician definition that Ms. Barnes just spoke of, that would be excellent. Mary, I don't know the answer to your question. If Josh knows, chip in. If not, we'll get you the answer.
Yeah, we deal with physicians all the time, and we're dealing with internists, and I know this does not necessarily define this part of our meeting with research, but there is a lot of need coming in within the medical community about helping them deal with families, and I do believe that this could be a gap that we're going to talk about later on in our reports that we're all supposed to be involved in. But I would like to really understand, are they talking neurologists here? Are they talking just the physicians within the memory disorder centers? Because that's a very small number when you're talking about the physicians that we really need to get involved with principles, with dementia-specific principles for helping our families.
I concur with you, and we will get the definition of that. If not during this meeting, we'll certainly get it sent back out to the group after this meeting. I also think that there's a broader discussion here about, just in general, regarding physicians in Florida. We certainly have a lack of them. We certainly have a lack of gerontologists in the state as well. Some question marks and recommendations might be forthcoming on curriculum as it relates to our state-funded medical schools. Additional recommendations might be regarding graduate medical education to make sure that we keep our homegrown doctors here and specializing in these fields. I think there are an awful lot of things physician workforce-wise that we could address. Josh,
thank you.
You're welcome.
Thank you.
Josh, were you able to reach Dr. Goldie? Did he send you a question or a chat?
This is Josh. He's sending it to us right now. We're having some difficulty with Ted Wolfendale and the audio. So, Ted Wolfendale did submit a comment to us as well. He noted.
Go ahead.
Okay. Ted Wolfendale noted that on page 56 of the National Alzheimer's Plan, there's a list of lead agencies with the projects that they're working on and the completion date, including research partners and the states that they're working with. So we took note of that, and we'll go back to the national report and see those agencies that are working in partnership with Florida and note that in the research portion.
Excellent. Okay. Thank you.
And then
Wolfendale.
And Dr. Goldie just sent us his comment as well. He said, these are academic physicians and scientists and are who contributed to these advances, and people like Dr. Goldie himself and Dr. Neil Graff Radford. And I just want to say that Dr. Neil Graff Radford and Samir Beckwith both were excused from today's meeting, just as a quick side note.
Okay. All right. Let me recognize Mary Barnes, who has her hand up again.
Sorry. I'm sorry. I'll take it down.
Oh, okay.
Representative Hudson, this is Josh again. Dr. Goldie also noted that our research in Alzheimer's disease is a collective effort involving bench scientists, physicians, psychiatrists, psychologists, and many other healthcare professionals.
Okay. I think there's, Josh, make a note. We've got to do probably do a separate assessment, and this might be something to reach out to the Department of Health and their division of MQA, and we need to determine how many folks we have actually practicing in things like gerontology and practicing in specifically, if we can figure out, and they might have some numbers as to who's actually practicing in the world of elder health care in that regards. So we need to identify some gaps there as well. So if no one else has any questions or comments regarding the research work group draft, I think we'll go on from there. If I could take a look at the agenda again, if you toss that back up. Thank you. Okay, we are now going to an update on the F4A provider data and maps. If you had the opportunity to look in your packets and saw the two different maps that were identified, one that addresses the different services available by region, and one that represents the different types of services available by region. I think to those of you that may live along the coast, I think you probably find yourself feeling like your communities are well served. If you don't live along the coast, it's a different Florida. So with that, let me turn it over to Linda Levin. But I will also say that, you know, part of my focus here is that we have got to look at Florida as Florida. You know, there's many of you that live along the coast, and that's great. I live along the coast. I happen to represent a county that sadly only has one green dot in it, and it borders another county, and they share that resource. We've got an awful lot of Floridians that have access to nothing, and so I want to make sure that this report also recognizes and values all Floridians, not just our coastal Floridians. So with that, let me turn on Linda Levin's microphone here and let her do her presentation on these. Ms. Levin, you're recognized.
Great, thank you, and good morning. First, I just want to remind everybody that the Florida Associated Area Agencies on Aging are also the Aging and Disability Resource Centers. And this data that you see mapped here are dementia-specific resources that are currently listed in our shared statewide database. So what you see in terms of the dots does not show the whole area that a dot serves. It just shows where they are located. Their geographic service area may be larger, but there's really no way for us to map that in terms of how large an area they actually serve. So what you have right now are two maps, as Representative Hudson mentioned. One is where all the green dots are. That's just, in general terms, the resources that are in this database that serve dementia, individuals with dementia. And then there's a second map which has colored dots. So it's the same dots, but now you can see what services they actually provide. And it's a little bit crowded in some of the areas, so I sent Josh this morning a zip file of individual maps, one for each of those services. So you don't have that yet, that just got sent to him this morning. So that'll continue to break down by what type of service is available in an area. And again, it shows where the offices are, but doesn't necessarily show the service area. For instance, many of the services are in-home services. So you see an office mapped, but they have staff who go out throughout the county. So that's a little hard to map, but this gives you at least an idea. This information has also been shared back out with each of the Aging and Disability Resource Centers to see if there are resources that didn't necessarily have as indicators in their information in the database as serving dementia. So there may be others that are not showing up here yet, but this was, I think it was a really good start for us to be able to see where there may be gaps that we may need to go back in and see and clean up some of the data and find out if there are other resources that do serve dementia, but they didn't indicate that when they were listed in the database. But this is a really good start here.
Well, I would certainly.
So I'm open for, if there's any questions on the maps, I'm happy to try to answer those.
Okay. Let me turn off your microphone and let me take questions from the group. And then if you would listen, Linda, and write them down and maybe answer them all at one time. It's very hard to do kind of the cross-communication between two people on the call. Okay, so the first person I'm going to recognize for a question or comment on the maps that has her hand up is Stacy Payne. Ms. Payne, you're recognized.
Thank you. Yes, and looking at Lee County and the surrounding area, I noticed on the one with the multicolored dots, we only have two different colors, but we have absolutely everything on that list except for two services available in our area, or resources available in our area. Exactly how do we get this corrected or updated to show the correct information?
Okay, that is a great question. I think the best way to do it would be to, because we obviously have sunshine law issues and so forth, if you are a member of the task force and you look at your county or your abutting county and you recognize that there is a problem and a service is missing, or one is there that shouldn't be there, because it works both ways, if you would notify Josh and he can reach out to Linda and we can look at updating and creating a more accurate map. Now, there was, as mentioned by Ms. Levin at the beginning, a additional file that was sent this morning that breaks down by each individual dot. And so we'll make sure that all of that gets sent to you, but also that we can make changes to that as well. The idea, of course, is obviously have good, complete data. And, you know, the other challenge will also be getting the data from some counties. Some counties are going to be great in participating and some are not. So, Ms. Payne, if you will submit your corrections to Josh, he will let Linda know, and we will get them squared away.
All right, one follow-up question, if I could.
Sure, absolutely.
What information should we be sending? Names, locations?
The best contact information you can get. So if it's the Lee County Center for Bereavement Counseling, located at McGregor, whatever the address is, point of contact, phone number, all of that would be helpful information. And some of the counties might have a resource guide, and it just hasn't been cross-referenced and updated to the state base yet. That's certainly possible. So the best data you can get is great, and the more complete the data, even better. If we have more data than we need, that's not a bad thing. Okay, let me next go to Christine Powers, who has her hand up. Powers, you're welcome.
Yes, thank you, Chair. I have pretty much the same questions. One, I don't see a lot of daycares on that map. But secondly, I was wondering if these resources were cross-referenced with ACA, with their licensed facilities, because I'm sure many of these counties have ALF and nursing homes within them. So, potentially taking a look at cross-referencing licensed entities. I, too, had submitted a map to the staff about the number of daycares in which counties. And my final question is there a way that we can get any statistics of how many reported cases of Alzheimer's or related dementias are within each county, so we know what kind of a population and what kind of a need of resources might be needed in that area?
Okay. Well, first of all, I think you've got an outstanding idea regarding looking at licensure databases. And Josh, I would ask you to either yourself or have the secretary reach out to Secretary Dudek over at ACA or Dr. Armstrong over at the Department of Health to ask for their assistance. And if need be, I'll certainly call them personally if need be to get the data we need from them from their licensure database to make sure that we are incorporating everybody. I think that is highly appropriate that way that we cover it. Because you're right, there are certainly, in my rural county, there is a nursing home, and they do have a dementia wing, but yet it's not really identified somehow. So I think that is important for us to do that. And the county I'm mentioning is Hendry County. In Clewiston, they have a skilled nursing facility, and it has a Alzheimer's wing there. So there are certainly some additional need for some updating of the map, and again, that's why we're having this meeting, so that we can make sure we cover all of those things. Regarding the individual counts per county, and this is something I do not know, there may be some rough numbers, but I'm not sure you could break it down that specifically by county, and of course the number is always changing. But if, Josh, if you have an idea as to where we might be able to ascertain that information, or anyone else does, would certainly like to hear that thought. So let me go back to Christine Powers, who must have a follow-up question because her hand is up. Go ahead, Ms. Powers.
You. Yes, thank you. Josh, would it be possible to get some of that information as far as reported cases from the search system through like the 701B assessment? Maybe identifying one particular, a couple of particular questions that were on that assessment that might be able to draw up by PSA the number of reportable cases.
This is Josh. Absolutely, we've pulled some data in-house on that, and we'll provide that to the task force. And to address the numbers, the county numbers, we'll work with our planning and evaluation unit, and also the Alzheimer's Association. We have a pretty good feel of individuals who are in Alzheimer's specific state and federal programs, as well as non-Alzheimer's specific programs, but the individuals with dementia or Alzheimer's disease who are served in those other programs. So we have that information. We'll get that for you. And Representative Hudson, I just wanted to let you know, as you're going through the list of questions, Natalie Kelly also has a question here.
Okay, very good. Well, as long as you're talking, you might as well throw it over to Natalie Kelly.
Thank you, Mr. Chair. Actually, this follows along with Chris. It's a follow-up with really what Chris asked, because when you're looking at this map, which, boy, it's kind of scary to see, but the adult daycares, and the question is for Linda if she can answer this. If there's an organization, for example, in Orlando, and they have 8 different adult daycares around Orange and Seminole, are you counting all of those 8 different, or is it just one for that particular organization?
All right. Well, then let me go back to Ms. Levin and let her answer that question. Linda, you're recognized.
All right, thank you. On that specific question, Natalie, I believe it should have all the sites listed on the maps, not just the main office. If they have multiple locations, each location should be mapped. So what we've done so far is we've sent the data back out to the ADRCs to verify and to see where there's gaps and where data may not have been classified and make sure it gets classified. But this should have each site if there are multiple sites. There was something else I was going to add. This is also, I want everyone to be sure that they understand that this is dementia-specific resources. So if there is an adult daycare that's not listed here, they may not have been listed as serving dementia-specific clients in the database. And those resources give us their information as to who they serve and what funding they have, and that's how they get classified. So if they don't identify themselves as serving dementia, individuals with dementia, then they're not going to appear on this map. But that's where the ADRCs are going to work to clean up that kind of data, that if they are serving dementia, that we get that included in the database.
Okay, and what kind of time frame do you see for the ADRCs getting this work done in terms of cleaning up that on their individual CSAs?
Well, that's going to take some time, so I need to find out from them how much time they think they're going to need, and I haven't done that yet.
Okay,
the data was sent to them this week.
Okay, I'd love to be able to have that data together and compiled so that we have it to turn in with our reports. So we've got to be able to truly identify our gaps, and that would be important. So if we can kind of encourage them to get that done, that would be good.
Sure.
Okay, I see a couple other hands up here. Let me grab those. We have Scott Solkoff with a question. Mr. Solkoff, you're recognized.
Thank you. My office is in Palm Beach County, and we've got a lot of dots, and I'm happy about that. But I've gone around other parts of the state, and I know that in some of the areas of the maps that have no dots or few dots, there are dots that I know should or have been there in the past and probably aren't reported. And I wonder, just by way of example, in Monroe County, I know that there's the hospital there in Marathon that has had dementia-specific caregiving groups. I don't know that they're still in existence, but I suspect that there are a number of programs by other stakeholders that are extant throughout the state that are not reported, and that we may not have in our databases. And I wonder if when we put out perhaps our next public notice, whether we want to include some type of self-reporting offer, just so that when we do release our report, which will go out to everyone, that there aren't people who feel that they've been slighted or offended, organizations that feel that they've been slighted or offended because they weren't included and we never gave them the opportunity to be included. I wonder if that would be something that would be doable, or whether that would create too much work on this end that we may not be able to verify them all. Any thoughts?
Well, yeah. First off, my first thought is that, number one, all the meetings we're having are public meetings to begin with. An organization that is engaged in providing Alzheimer's or dementia care is going to be involved in their community and probably involved with their ADRC, and obviously the ADRCs are aware of this. So I think there's certainly been an outreach. So for someone to say that they didn't have an opportunity to participate, that is to me, I don't consider that to be a valid excuse. Now, that being said, I don't want there to be anybody that feels that way. And I would certainly say that we can certainly go about the process of making sure that our next meetings are noticed further in advance, perhaps. We could also make sure that a individual note goes to each one of the ADRCs from the actual agency itself, so that they can, with a note to encourage their individual entities to participate in that and to provide feedback. All of those things are very valid. At the end of the day, I don't want there to be anybody that feels like they didn't have an opportunity to participate. I don't want anybody to feel that they were excluded. And I want to make sure that we have accurate resources for the citizens of Florida to know where their resources are, and also, more importantly, so that decision makers can see how to react to those abundance of resources or lack of resources. And so, Josh, this is to you. Please make sure that the next meeting is noticed well in advance. Please make sure that a personal note goes out to each one of the ADRCs, the directors, preferably if you want to draft a letter that is coming from me as chair and as a legislator. We can send it out directly, encouraging each ADRC to participate even further. I know that Linda Levin has already worked very hard with her groups to get them to move forward. Keep in mind that this group is this isn't the only thing that those groups have to do. They are very busy folks and handle an awful lot of the choice counseling and so forth, and are very busy. So we certainly want to make sure that we get everybody engaged. So Josh, if you would work, maybe give me a call afterwards. We can look at a strategy for trying to create a draft letter to reach out to the individual ADRCs directly. And let me go back to Mr. Solkoff for a follow-up question.
I think it's very, very sufficient, and I know that we've been very careful on giving public notice, and everybody's had an opportunity to respond, so I think that would be more than sufficient.
Okay, excellent, excellent. Let me go to someone else with their hand up here. One moment. Gloria Smith, you have your hand up. You're recognized.
Yes, thank you. I think this is probably the most important piece, because before we can identify gaps in service, we really need to know what exists. And I think this is an excellent first step, but I think it's missing a lot of the millions of dollars in private funds that are providing services, whether it's the Alzheimer's Association chapters, the AFA members. But the department is working on that. I think in one of our earlier caregiver subcommittee meetings, we talked about developing some kind of collection instrument, if you will. I think Mary Barnes had agreed to look at some of the AFA member agencies and need the chapters to try to pull what other services that might not be on the radar screen because they're privately funded. So I think that will also help give us a better picture of this.
Okay, excellent. I was just getting ready to go to Ms. Barnes next. She has her hand up as well. So let me see what comment she has. Ms. Barnes, you're recognized.
Thank you, sir, very much. I appreciate it. I hope I'm not a pain in the butt, but pain in the neck, rather. Not everybody that we serve, and I agree with the former presenter, that fills out a 701B. And we do have a great many of those. So I just want to caution that you're right. There's a lot not being captured, even with the ARCs, although we try to keep our ARC very informed. There are 6,800 licensed home health agencies between Palm Beach, Broward, and Miami-Dade. Our organization does a quantitative, we do a quantitative document where we ask these home health agencies, before we put them on our referral list, that they actually, so in fact, provide training, and they do it on an annual basis. Otherwise, and it is all by the honor system, we're not a policing organization, but we do not want them on our referral list unless they actually so in fact do that. The other thing is we don't make referrals to the legal department unless they're a certified elder law attorney. So we have developed standards within our organization, because there are so many that want to be on our referral list, because our family nurse consultants, who are our care managers, and they're the spin zone for the organization, deal with the crisis line and deal with all those other calls, that they must have some sort of boundaries that they must go by. And giving our families these referrals is very precious to us. We want to make sure that they're going to get the kind of service, and we stay very close in contact with them. So there's a lot of that going on in, and I agree, and NOVA, and I just want to do one other thing. NOVA down there in Fort Lauderdale, I'm working now with a group that is coming up with a physician's training program that has been paid for by the federal government on evidence-based types of curriculum. So there's a lot of things going on, and look, and then the last thing I want to say, I'm going to put all this in an email to Josh just so I don't miss anything. I don't see anything about disaster preparedness on this list of services. And I really, disaster preparedness and that whole issue is very near and dear to our heart. So is that just not important, or is that not necessary for this type of documentation and resources? But I think disaster preparedness is critical.
Well,
thank you.
No problem. Obviously, disaster preparedness is important. There's no question about that. We do have a disaster preparedness group that is looking at things, and I think perhaps that can either be a separate map or a separate set of resources. You know, we do have to be somewhat careful that we don't create a map that is so convoluted that nobody will understand it, or would need to have the map being blown up to wall size to make all the dots make sense as well. So we may need multiple types of maps. Let me go to Christine Powers that has her hand up. Christine, you're recognized.
Yes, thank you very much. I wanted to follow up with the notification. There are a lot of state organizations, associations, such as, well, obviously the Florida Adult Daycare Association, but I'm thinking more about the Hospital Association, the nursing home. I don't know if there's a local AMA, but those individuals, they may not notice those public notices. It would be kind of nice just to send them a personalized letter letting them know what we are doing, because there may be many hospitals out there, as well as neurologists, that do provide internal services or have their own programs that, you know, are dementia specific. So if there's a way that all the associations could be notified in the state, that would be great, or at least the key ones.
Okay, duly noted, and something to work on. Ms. Barnes, you have your hand up again. You're recognized.
I just wanted to comment that about the map itself. When you've got a red dot, and I guess the red dot is supposed to identify adult daycare, all the services that Alzheimer's Community Care does provide is very standardized throughout all Palm Beach, Martin, and St. Lucie County. So the one dot is not really tell the whole story about the crisis line, about all the groups that are involved, the collaborations that are involved in that community, the daycare, the care managing, this case management, case management, and all the other wraparound services that go. So that one dot is very significant to us because it has a whole cadre of and a whole menu of services and resources, and the same with Martin County. And we cover St. Lucie, Martin, and Palm Beach County, all of them, so the whole territory. So basically, I just wanted to say that. And with private funding, a lot of it is not funded by the state. It's funded by local donations, fundraising, grant writing, and all that. So there is a whole part of our budget that is when the state gives us an investment of dollars, it expands to one for every dollar, 1 and 5. We match it by $5. So, thank you.
Very good. It sounds like you're going to have a very hearty email to be sending to Josh. Ms. Powers, you're recognized for another question or comment.
Yes, and just to kind of reiterate what Mary was saying, there are a lot of organizations out there that are privately funded, and I'm not sure that they're reporting to the ADRCs. One comes to mind in particular is the Brookdale Foundation, who was very instrumental in the state in providing seed money to establish neighborhood respite programs as well as the early memory loss programs. And I'm not sure those are identified or even recorded anywhere in this report. So that might be, food for thought.
Good point, and certainly something to add to your email coming back to the department. If they're, frankly, if they're not publicly funded and they're not reporting to the ADRC, unless you're aware of them, most kids are not going to be aware of them. So you'll need to let us know of those organizations so that we can make sure that we reach out to them if possible. If there are no other questions or comments on the maps for now, if we could go back. Okay, we are getting fairly close to our point of finality here. We have 15 minutes. So we've kind of talked a little bit about an update on the gaps assessment, which is kind of what we were discussing there by looking at the map. So Josh, let me throw it to you to discuss the update on the gaps assessment.
Thank you. I'll be brief. Just wanted to let everybody know, along the lines of what we've been discussing already, it's been difficult for us as a department. We have a pretty good idea of the federal and state funding, but a lot of the things that we're reaching out to the task force members for is that private funding. The last thing I'll say on this, and we can move on if you'd like, to disaster preparedness, is that the Providers Caregivers Committee met last week, 2 weeks ago, and specifically to address the gaps assessment, and there was a list of questions that was sent out, and so some of the members of the task force are working on identifying some of those gaps, because there's no one resource that we have available that we can identify everything. So it's something that we're cognizant of, and I think the members of the task force that we've had conversations with and the committee meetings are cognizant of, and everybody's looking at ways to try to identify as much as possible, both federal, state, local funding, and then purely private funding as well.
Okay, and at the end of the day, I think it's a safe bet to say that we are probably not going to have a perfect perfect document when it comes to each individual community and each individual county around the state. There are certainly going to be initiatives that are going to be started by individual municipalities or by communities that are well-intended programs that just may not meet our radar screen yet. And so at the end of the day, I would ask for a little bit of indulgence and patience from the task force to recognize that we're bound to miss something along the way. It will certainly not be intentional, but we do have 19 million people in Florida, and reaching out to all of them in a way that will capture the information we need is not the easiest thing in the world. So along the way, it's your feedback and your diversity and knowing your communities that will really make the difference in communicating to our staff. Thank you, Josh, for that. Josh, if we could get an update on the disaster preparedness information, that would be Corey Livingston.
Thank you, Representative Hudson. This is Corey Livingston. I am with Elder Affairs. We were fortunate enough to have an intern from Florida State University with us during this past term. She was responsible for the executive summary, and I will pass along your wonderful comments to her. She also gathered some data by looking at the different county emergency management operations sites online. Her purpose was to find how easy it was for someone, a caregiver, or someone with the early stages of dementia to find shelter for themselves during a disaster. What she reported to me was that she found great disparity among the sites, diversity, there was a variety of the way that the information was reported, a lack of consistency, use of jargon that was difficult to understand. Some of the websites were too busy for easy navigation. The small font size on websites would be difficult for someone who, like me, has presbyopia and can't see these things. Some of the sites, though, did address disaster preparedness for special needs, and at least 2 of them mentioned Alzheimer's disease and dementia. Those were two counties that were Brevard and Volusia, and they had specific, very specific criteria for special needs sheltering in those counties, and I would applaud those counties. Many counties referred the searcher back to the Florida Division of Emergency Management site. Some of the links that were on the Division of Emergency Management site did not function, so you would try that link and it would say, you know, link does not exist. You'd get an error. Some sites did not appear to be up to date. One county's banner for emergency management noted Hurricane Isaac, which was 2002. But overall, there didn't seem to be a clear trend regarding rural versus urban counties. At least one rural county, that was Holmes County, provided some clear, concise links to information, and they had their special needs assessment form online. One of the larger counties, one of the large urban counties, had a plethora of information, but it was extremely difficult to navigate and difficult to find anything having to do with Alzheimer's disease. And her comment to me was that a caregiver would be overwhelmed. In all, she said there were a lack of phone calls placed where someone would be able just to pick up a phone and call and ask the question. She said overall the lack of consistency, the disparity, the diversity, even though there can be strengths in that, there were problems with that. Thank you.
Well, that is that's good detail and certainly really concerning. Wow. Do you have, I assume you have that all in some kind of a spreadsheet format that she did to break down each individual county and so forth?
I have it in a Word document, but I also have what she did was print out several of the counties for backup documentation. I can put that into a spreadsheet for you.
I think it would be good to know by county where we stand. You know, which ones address the issue, which ones don't address the issue, which ones apparently didn't know that Hurricane Isaac is no longer going on. You know, I think there's clearly some gaps there, and frankly, I'll just tell this to the task force. If you give me that spreadsheet, I'll literally go talk to each member of the legislature that's affected by that particular area that may have a gap, and I'll talk to them personally to reach out to their sheriffs to fix it. That's aside from the task force, because that's not something statutory. That's just something where you got to kind of get somebody in the fanny to get their job done. With that, there is probably some additional work that needs to be done regarding disaster preparedness. And I think I'll throw it to Mary Barnes. She had a question regarding emergency preparedness and the gaps assessment, and she's also on the agenda. So let me give that Mary Barnes an opportunity to address this as well. Mary, you're recognized.
Thank you very much, sir. I put together a report and a document on how we work with Palm Beach County as a partner with their shelters and their training and their admissions and their discharge planning, and as an organization working on the backside when the hurricane, post-hurricane, and helping them with the families and reaching out and just setting up our resources and services so that families in Palm Beach County, which is projected to have 60,000 Alzheimer's patients, have those resources, as well as we filter that up to Martin and St. Lucie County. So I don't want to go into I think the document, and we're running out of time. It's very comprehensive. I gave it to Josh, but there are some recommendations on the back of it that we might want to talk when we're talking about where the Purple Ribbon Task Force wants to go and deal with on like flying at 80,000 feet and being able to address the disaster preparedness. And again, the health department and the disabilities community has done a lot of work on that too. Alzheimer's and this organization fits into three categories: the elderly, the disabilities, and the mental health people. So they've all done bits and pieces on a state level, And the Special Needs Interagency Committee that was developed right after Jean and Francis has done some very good work with some working with the EOCs and working with the health departments. So we just fitted in and put in a niche with the health department and our EOC here, and coming up with this because we have such a high risk, vulnerable, endangered population, being that support system. And that's kind of what our document reflects. So.
And you've sent that document to Josh?
Yes, I have. And
Okay.
I've got about 7 recommendations in that document on where the committee might want to go with this. I think this is a critical piece for Florida, especially when we're looking at hurricanes and the kind of flooding and all this other types of, and they're a big population of ours. So they are definitely, I really don't ever want us to have a Katrina and having our people that people don't recognize, and being everybody should be aware and able to help because they're aware of the disease. So
I certainly concur, and as a former fire commissioner, I get it, because it's not just hurricanes. How do you handle wildfires in North Florida? How do you handle brush fires in Southwest Florida? I mean, there's a myriad of issues. So, Josh, just if you would make that document available to the group for them to review, I think that would be helpful. We are running out of time. We have about 4 minutes left. I just want everyone to look at their agenda for a moment and take a look at the timelines. These are exceptionally important. All the various task force and subcommittees, you have a timeline to get your data and your edits and your corrections and your additional information and so forth to the department by the 28th. Any comments on the executive summary, very specific comments that were mentioned today, they need to be addressed and submitted to Josh as well by the 28th. Everything is by the 28th if we can. Then from there, we will be sent a new interim draft report that will come to us on the 4th. We will get together again on the 9th to discuss that interim report. After we have our discussion, again, we will have a period for comment so that you can submit more edits and so forth to the department. We will then have all those edits compiled, and we'll have our interim report sent back to the task force, where hopefully on the 28th of January we'll be able to approve that interim report, and then it can be submitted to the legislature on the 30th. That is the timeline. We have a fixed timeline because it must be submitted to the legislature by January the 30th. I cannot impress upon you enough to get your edits in and your comments in a timely manner. With that, we are at the end of our time. We cannot go over due to public meeting notice requirements. If there are any other comments and any other concerns, please submit your comments and or concerns to Josh, as well as any of your edits for the executive summary and your data points for your subcommittees. With that, the meeting is adjourned. Thank you very much for attending today.